I'm Claudia Williams. I'm the Chief Social Impact Officer at the Berkeley School of Public Health. And we are so happy and excited about this conversation and mostly about your interest in public health and interest in Berkeley and just want this to be a very small part of a very warm welcome of all of you into this community. I think you'll find and you'll be hearing from two students today who work with us and collaborate, more than two maybe. But this community is so incredibly special, and we are a small part of that. But I think you'll find it's such a great place to grow and build and do amazing things, and is ready to welcome you. So just as a quick agenda, what we wanted to do today is share a little bit about our social impact work and how you might be able to get involved and engaged in this work as students. So I'll start out and just give a brief overview. I'll be followed by Kelly and Fred, who will be talking about the programs, and then we'll have Rue and Anya, I think, share some of their personal stories about the things they've been involved with. If you have questions along the way, do we have time at the end, Fred, for questions?
We should have some time, depending on as long as we keep our remarks.
Sure. What I
Exactly.
would suggest is as you think of them, just put them in the chat. What we probably won't take time during the presentation to answer those, but we'll get to circle back to those at the end. So please, any comments, observations, emojis, whatever you want to share, put in the chat. All right, if you could move to the next slide, the next one.
Excellent. Mhm.
So UC Berkeley as a whole has committed itself to not just being a place of academics and research, but being a place of service and impact. And we at the School of Public Health are doubling down on that. We believe it's important to be a place where impact happens, where we bring our best ideas, our best techniques together with the people in the world who are also making change as policymakers, as entrepreneurs. So we are a bridge in multiple ways. We're a bridge between the knowledge and the how do you make change with the knowledge, and also a bridge in this team between the world of public health at the school and the world of our communities and other folks out who are outside the school boundaries. It's also important to remember we're an activist school, right? We have a strong and enduring and proud legacy of change making, whether that's faculty that have helped introduce soda taxes, have worked on important reproductive rights as well as contagious diseases, but also things like how do you provide housing and other services in the best possible way. So we have that legacy. We try to remember to go back to it and learn from it and really build on that. But that's the kind of school that you'd be coming into, is a school that's committed to impact and that is a proud carrier forward of the legacy of activism and commitment to that. Next slide, please. Um, and getting more concrete, the School of Public Health is committed to being the number one school in the world for social impact. That's not to say we would be happy if we were tied with 50 other schools, right? That would be a great outcome. But what we want to do is figure out how to organize our resources and enable all of you to be change makers in the world, both while you're students and when you get out. And so what you'll be hearing about with the programming is our first gen set of ideas. We're also constantly looking to evolve that, and we'll be looking for your feedback and ideas to do that. But if you're somebody that wants to make a big impact in the world, that wants to have your education and public health be centered on purpose, we hope we can help be part of that home for you in doing that kind of work. Next slide, please. Uh, This is just three of us. We actually have, I count all of the people we work with, our students. We see on the line Devin, who's one of our student fellows with the program, Rue and Anya, who are participating in one of our programs. But briefly, you'll be hearing from me, Kelly, and Fred. We all have our own legacies and histories of work outside the university. I myself have been a federal policymaker both at the White House and HHS. I think really understand how to use those tools for change. Kelly has amazing background in entrepreneurship and in working for startups. And Fred combines those two, having worked at Hope Labs and also on HIV policymaking. So we, I think, are people that can carry that torch and those lessons of how do you combine this world that we're in that's academic and the world of impact outside. Next slide. Next slide. This moment in time calls for this. I think we are all living in a time of a lot of uncertainty. A lot of people are very worried about the future of things they care deeply about, whether that's trans rights or Medicaid or science and the funding for science as we go forward. And so, what better place to be than a place that's committed to not putting aside our purpose and our mission in this hard time, but figuring out how to be strategic and smart and future leaning and investing in that as we go forward. I think we're going to have tough times ahead, all of us as a society and public health in general. And I think this is the right community to figure out how to navigate that together and how to not. I think you'll find at some universities, you literally wouldn't even know that we're in challenging times if you went to their website because they're kind of worried about not wanting to be a target. And I think what we're trying to do is be a home for that change, for that purpose building, for the advocacy and things that we need to do, particularly right now in this time in our nation's history. Next slide, please. So I want to, well, this will come up in others' presentations, but there are three particular areas that we're looking to build out programming that you might participate in and projects and bring in other people from outside the university. One is this activism and advocacy and policy action. I mentioned that already. The second is incubating and innovating solutions. You know, Berkeley is number one in the world, probably, for the number of venture-backed founders who are starting companies. We want more of that innovative spirit in public health, whether that means you're going to end up founding a nonprofit or working for a startup or just bringing that entrepreneurship, kind of social entrepreneurship energy to whatever you do. And the last is partnering with communities. We live in an incredibly rich and impactful area of Berkeley, Oakland, Alameda, Richmond. And we're looking to be the best possible partners for that community and help you also be involved in those communities in your work as students. And I think that's my last slide. I'm happy to answer questions at the end. And I believe I'm handing it off to Kelly. Is that right? Or Fred? One of you.
It's going to Kelly.
Kelly.
Yeah, thank you so much, Claudia. I'm really excited to share a bit more about the specific social impact programs that we run for students. So I'm Kelly Horan. I manage our social impact innovation programs. Previously, I worked in startups, did some time at Nike, hopped around a bunch before going to Berkeley to study what I was really passionate about, which is innovation in the health space. So I'm a proud MPH alumni. And one of my favorite things about this role is getting to bring the programs to students that I wanted when I was a student. I think that this more entrepreneurial work can be such an amazing complement to the academic work you're doing. It's also a really wonderful way to build your network when you're at Berkeley. The programs are largely open to students across campus who are interested in issues like health equity. So you'll meet both Berkeley Public Health students as well as others. I was so excited to see on this call a student that I had met and worked with in the Goldman School for Public Policy that I just found out is now coming over to Berkeley Public Health. So the community is really a wonderful thing and a wonderful part of being at BPH. The first program I wanted to talk to you about is Social Impact Tuesdays. This is something new we offered this year. It's a one-unit course where we bring in leaders in the field of public health who are right now going out and making change within the field. And they're going to share some of their particular change maker type skills with students. If you could go to the next slide, Fred. So here's just a few examples of some of the absolutely incredible folks we've had come and speak to us, from Tony Iton, former SCP of the California Endowment, trained as both a lawyer and a doctor, and just an absolutely incredible public health professor here. to folks like Marina Nietzsche, who's the former CTO of the VA, as well as student entrepreneurs who are actually in our program, like Rue, who's going to be here to share more with you all today. You could go to the next slide, Fred. So we continued Social Impact Tuesdays into the spring, and again brought more just really amazing folks doing work in the field to share particular skill sets that you as a public health student can build. And if we keep going, I'm also so excited to share with you about our Social Impact Innovation Program. So this is the program I was brought in to help create and run. And I just absolutely love it. And the reason I love it is because of the students, because you all have such amazing ideas. And it's a really wonderful platform for taking your own idea and getting some funding to go out and build that idea. So what this program does is it provides up to $15,000 in funding per team to create a student-led, community-partnered project to advance health equity. So that's a pretty significant amount of funding. It's quite a bit more than some other programs on campus provide. So it's a really significant opportunity for you to really be a leader and execute on your own idea. I will say it's competitive. We always have a number of absolutely incredible applications. So it's why I'm actually really glad to be speaking to you now, because you have a little bit of time to start thinking about your ideas. You can, of course, participate in this program your second year of your MPH too. But I always love to see first year MPH students coming in with ideas right out of the gate and participating. So if you go to the next slide, Fred. Just an example of some of the teams that were in our first year cohort. They were just truly incredible. I think it was our first year running the program, and we were just astonished at what everyone was able to accomplish. 2 of the 8 teams have founded nonprofits and are continuing their work. So we had a doctoral student working on building global youth mental health advocacy. We had an amazing student, Rue, who's going to be speaking to you in a few moments, who was working on increasing Black lactation in Solano County. We had a team from the optometry school that was improving access to vision screening for kids in Head Start, and more. So if you go to the next slide, and then we actually just selected our year 2 cohort. So we also have a really wonderful student from our year 2 cohort who's joining us today. Teams working on things like ending gender-based violence in Richmond, working on worker training for uranium mine remediation on the Navajo Nation, culturally tailored lifestyle medicine cooking program in Oakland's Chinatown, partnered with an FQHC. And we are all donor funded. So the program will be continuing, and we're so excited to hopefully welcome some of you into this program in future years. Great. So now I asked 2 students to join us today just so that you guys could have a little bit more of the student perspective. And they're just going to come on and share a little bit about who they are, what they worked on, what they liked about the program, etc. So Rue, if you wouldn't mind coming off mute, I'd love to introduce you first. Rue was an amazing team lead in our 2024 Social Impact Innovation Program. Thanks, Rue. Oh, Rue, are you still there?
Yes, I am.
There you are.
Okay, great. Go ahead and feel free to share a bit more about yourself, your project, and what you liked about the program.
Okay. So, hi everyone. Thank you so much for joining. I'm so excited to be able to just talk about my experience and the program. So, my name is Rotendo Ajayi, but I go by Rue. And I just had the privilege of just coming to Berkeley, where, it's the epicenter of creating public health leaders and change makers. And one of the greatest things is just having the opportunity to actually apply the things that we're learning into the communities through the Social Impact and Innovation Grant. So I was part of the inaugural team. And our focus was on Black Lactation Matters, which was to increase the Black breastfeeding rates for mothers and their children, and to also combat the maternal mortality disparities, because as we all know, deficiencies lead to diseases. So it was just a wonderful experience to get hands on. And as you know, community is essential in terms of sustainability. You don't want to be one of those that just drops in and drops out. But one of the key things about UC Berkeley is thinking ahead and forward thinkers. And I just think, in terms of public health, it's a field of responding and not reacting. And as we see in today's society, it's even more important that we respond. And so through that, I've just had the privilege of gaining so much knowledge. I know that growing up, my mother always said, you reap what you sow. And one of the things was I created this acronym that made me decide Berkeley was the place for me. And I'll share it with you all. So the R stands for just in terms of what is the reputation of the school. E is for what will my experience be? And coming here has just been a wonderful experience. Meeting diverse people from all sorts of various backgrounds, but we all we all share the same mission, values, and vision for our society. And E is just in terms of the academics. It's been amazing. And as you all know, UC Berkeley in terms of public health has consistently charted top 10. So, and then P is for purpose. Does this school align with the purpose and the plans that I have in terms of my own career goals? And Berkeley, hands down, was the best choice that I've ever made. I will be graduating this year, and it has gone by so fast, but I can't speak highly enough. You know, you gain to give, and I just want to make sure that I'm able to give back to my community and also to future students like you. So go Bears.
Amazing. Thank you so much, Rue. And I also just really want to reiterate that there are these programs here at Berkeley for students like you, and we really want to support you. I think sometimes Berkeley is a big university and it can feel overwhelming, but I find it helps when you know there's an actual person behind that program and that those people are Claudia, Fred, and I, and we're excited to work with you and are happy to chat with you if you have questions. And so now I'm super excited to introduce Anya Fang, who is from our Social Impact Innovation Program this year. So she's just getting started on her project. She's only been in the program for a month and had funding for a month, but she's already done amazing things. So Anya, if you wouldn't mind just introducing yourself, telling folks a bit about your project and then your experience at UC Berkeley so far. Anya is a first year MPH, so she just finished her first semester.
Yeah, absolutely. Hi, everyone. My name is Anya. I'm currently a first year MPH student in the Health Policy and Management program. Prior to that, I also attended UC Berkeley as an undergrad. Loved it so much that I knew I had to come back later on. In between that period, I worked in healthcare research, primarily around the behavioral health services. Also dabbled a little bit in tech. Realized I really love public health, and that's why I'm here today. And in terms of my project, and it's been really such an honor to be a part of this program. I work with a team of 4, and our goal is to empower aspiring and current community and mental health workers serving Asian American and immigrant populations in the Bay Area by providing opportunities to engage in workshops centered around advocacy, community building, and professional development in partnership with various community-based organizations here in Northern California. It's been really exciting. We've gone off to a quick start with a lot of the programming that we've wanted to do. So, for example, we've recently hosted 2 workshops, largely catered to students here at UC Berkeley who are aspiring to become community and mental health leaders. Our workshops were centered around things like community health career preparedness, cognitive behavioral therapy, and we have a lot more topics on the horizon for the next few months. Something we're really excited about and have been able to offer because of our grant is being able to take our students, community members, existing healthcare leaders to go on a trip to Sacramento to engage with the Steinberg Institute, which is a really wonderful mental health policy organization. And in terms of my experience with the social impact program overall, I think the biggest thing for me is just the instilling of confidence I had from interacting with all of my peers during the Social Impact Tuesday workshops, working with all of the wonderful staff members. I think, coming into UC Berkeley, I wasn't sure how much I would be able to achieve. And honestly, I've been with my team, we've been able to do so much more than we initially anticipated. So I think that's the greatest benefit I got from this community. And yeah, I really hope all of you consider joining this program as well.
Thank you so much, Anya. I love that you mentioned leadership because I mean you and Rue are just such phenomenal leaders, and I can't wait to see what you do next after all of this. So with that, I'm going to hand it off to Fred, and please feel free to reach out to me directly if you're interested in learning more about these programs. All of our emails will be at the end of the slides.
Wonderful, and yeah, happy to share. But I wondered, and I don't mean to put you on the spot, Devin, but I wondered if you just wanted to share anything about your experience with the social impact team, if you're up
Yes,
for
bring
that.
Devin on.
Yeah, definitely. Hello, everyone. My name is Devin. I'm a first year master's public health student, specifically in health policy and management. And I was going to say, love working on the social impact team. Specifically, what I do is I help assist Kelly. So I help assist her with the Social Impact Innovation Grant Program as well as Social Impact Tuesdays. And I feel like overall, the Social Impact Program is a really good opportunity to help develop your changemaker skills, and you really get to tackle different public health challenges from different perspectives and work with just the community at Berkeley Public Health. So would definitely recommend if you are interested in developing community-driven solutions and addressing health equality or inequalities. Yeah, thank you so much
Yeah,
for having me here.
of course. And thanks, Devin, so much. And we couldn't do the work we do without all the work of the students who are just amazing and bring so much of their creativity and their passion and their ideas to make this work possible. So I just wanted to say that. So my name's Fred Dillon. I use he, him pronouns. I'm the director of partnerships and strategy for the team, the social impact team. As Claudia mentioned, I previously was the policy director at the San Francisco AIDS Foundation for about 10 years, and then worked at another organization called Hope Lab that develops technologies to improve the health and well-being of adolescents and young adults, most recently really focusing on the mental health and well-being of adolescents. So long history and supporting startups in that space. So that's a bit about me. And then the programs I want to talk about, one of the first ones is the Impact Fellows. So we have a program, inaugural program that started again this past year. And we have 9 public health leaders and change makers who are mid-career to late career and are actually out there making change in the world. And they have agreed to be fellows with us and really share their expertise with students, to be mentors, and to also build new impactful projects that they want to work on as part of their fellowship program. And they just bring this total wealth of experience and talent to our students and to the community, and are so grounded in the practice of public health, which is really important, because I think it's one thing to hear the theory and get the skills. It's another thing to then see how all that comes together with the actual practice. So that's what we're all about. And these are the fellows we have this year. They're really an amazing group. I'm just going to briefly mention each of them. Nate Favini's on the left there at the farthest end. He was chief medical officer for something called Pair Team, which is a startup working around Medicaid eligible populations and connecting them with various services. And so they partner with community-based organizations all over the state and country. Tony Aiton, Kelly mentioned briefly, is an amazing faculty member who also was the former senior vice president at the California Endowment and really led the way on health equity and in people-powered community building. That's really powerful. Shruti Kothari, the next one is head of industry initiatives at Blue Shield of California. So brings a lot of skill around bringing the industry in and into policy making. Lisa Simpson, the next one, is former head of Academy Health, which is all about how do you turn research into actual policy and how do you make evidence make a difference. So that's what Lisa's bread and butter is. On the far end is Ruth Thomas Squants, who heads up something called the Healthy Places Network, and it's all around multi-sectoral collaborations to improve health equity and racial equity. So amazing there. At the bottom on the left, Thomas Getz is the former editor of Wired magazine and has also founded several medical startup, health-related startups, and has just great thinking on communications. Kasley Killam is next, and she is a pioneer in social health and really the importance of relationships in our lives and how that helps bolster our health, and is really leading the way. She has a book out called The Art of Connection. Marco Meek is the next one, and he is the former Undersecretary of Health and Human Services for the state of California. So again, we have this great pool of people who have actually done policy making and policy implementation. And finally, Rainbow Rubin is a former alumni from the school, and she really leads up a whole host of work on environmental harms, especially related to cancer, and works as the science translator for the breast cancer research partners. So this is just an incredible group of people that we have at our fingertips that we can connect with students and bring in a whole variety of ways. Just as examples, we had a convening on the societal impacts of the Dobbs decision that Lisa led. I'll talk more about this, but there's a Medicaid innovation pitch event we just had with that Nate Favini helped lead. We had strategy sessions on policy and comms with our team, guest lectures, and a variety of other things. So this gives you a taste of how we've leveraged these fellows in the work of the school this year. And we are, this is the group from this year. We're actively now recruiting the next batch of fellows who will come on in the coming year. So Claudia and I are hard at work at recruiting those folks, interviewing them, and getting the selection in place. So we'll be excited to announce those in a couple of months. We also are actively working on local community partnerships. Claudia made reference to this, but one of my jobs is really to make sure we are aware of and connected to a whole host of the community-based organization, the East Bay. This is just a smattering of the ones I've spoken to and that we're connected with, but some of these connections have led to, for example, the Asian Health Center, Asian Health Services Healthcare Center, resulted in one of our student teams doing a program with them in the current cohort of the Social Innovation Impact Grantees Group. We also host a whole array of events and workshops that include working with our fellows, include working with our local community partners, bringing in folks to really give students the experience of what's going on out there in the world related to this. And a couple events I just wanted to reference that recently happened, like literally hot off the presses. We had some events related to Stand Up for Science. It was a big rally in Sproul Plaza here at Berkeley around some of the attacks that are happening on science. So this was all around how can we defend science. And we did a sign making event with students beforehand. You can see some of that happening here, and then all went to the rally together, which was a really great moment of solidarity and excitement. And then the other event that has been mentioned was the Medicaid Innovation Competition, which just happened this week, where we had there were 6 teams who were finalists out of a group of teams that's applied, who pitched their ideas for innovative companies in the Medicaid space. And so it was a great opportunity for these teams to come up with something innovative and then present it to a really impressive panel of judges and get real world experience of that, and feedback on their ideas, etc. So that's something that just happened. The one other thing I'll mention, this is Claudia's baby, is something called the Other 80 podcast, where Claudia interviews various folks on a podcast who are really doing stuff beyond medical care. We know that in health, in our own health, 80% of it is not related to the medical care we receive. It's all of these other factors around us. So that's what the podcast really focuses on, and how we can really pay attention to that other 80%. And so Claudia's getting near to the 50th episode of that podcast. So really exciting that we have these connections with all of these experts. So here is our contact information. Just wanted to put this out here so that if you had any questions following this or wanted to follow up with any one of us, we're happy to speak with you, set up time, etc. But are just really excited about your interest in being part of our community. And I think that is it. I'm going to keep this up just so you have that. But wanted to open it up to any questions or comments you all may have as potential incoming students. And you can either jump off and come off mute, or you could put them in the chat.
One thing I'll just add while folks are thinking about questions, I know Fred shared the Impact Fellows, and these are just really amazing leaders in public health. And I think sometimes students can feel intimidated, like, oh, would they want to meet with a student? And I just want to say definitively yes. The reason the Impact Fellows want to be involved with Berkeley is because they're so excited about students and working with students. And so it's just an awesome opportunity to expand your network and meet folks. And so I would just really encourage you when you're here, because you're all going to come, to take a look at those folks.
Okay, I see a question here, Kelly, that probably is really great for you. It's what types of support can students get for forming projects?
Yes, this is a great question. And it actually affected how we led the program for the second year. So I wasn't totally clear on this, but Social Impact Tuesdays, the 1 unit course is required for those applying for the Social Impact Innovation Program. So by being part of that course, I think even more in our third year, we're going to provide really clear guidance on developing your project, building those community partnerships, because again, a huge focus of the program is that you're going to be working with local community partners, which also helps with sustainability. So you'd be in Social Impact Tuesdays. It's also a great way to meet teammates. I remember when Anya came to my office hours and she was like, I have an idea. I don't have a team. She was like nervous about meeting a team. And then like a month or two later, she had 4 team members. So there's really a lot of opportunities to meet other interested folks, pitch your idea, which again is another important skill set, and like develop and refine your idea as well to then apply. The application for the funding then isn't due till after the fall semester. So you have the whole fall semester to be developing your project and team. Oh, and it looks like someone was wondering about when applications open. So the first thing you need to do, and we'll make lots of announcements about this when you're here in the fall, the first thing you need to do is enroll in Social Impact Tuesdays. If for some reason you have a critical course conflict, let us know, but you'll want to be in that 1 unit class, and then you'll take the class through the fall and then apply in at the end of the fall semester for the funding and implement your project then during the spring and summer semester. So you have about 6 months to implement your project and use that up to $15,000 in funding.
Fred, can I answer this last question on getting involved outside of fellowship or Social Impact Tuesdays?
Sure.
I will say, this is our first year in existence as a team. And what we're looking to do is build out more opportunities that respond to your interests and needs. So one of the things Kelly's has on our radar is to actually start a student advisory council that can tell us, here's what we want. So we have a lot of ideas there. We want to do more trips to Sacramento, as was mentioned earlier, more opportunities to build specific leadership kinds of skills. We just did Fred just organized a site visit to Berkeley Public Health, the county public health. But mostly we want to hear from you. So also, if you're interested in this area, stay tuned for a notice in the fall about potentially joining that kind of an advisory group, because this is meant for you. This is built for you. And we just want to do everything we can to meet your needs. So that's just a pitch for that process.
Great. I see a question here about the Impact Fellows and how you can interact with them throughout the year. And there's really, a wide range of possibilities here. Everything from we share who the fellows are early on in the beginning of the semester. And if you're just interested in connecting with them, many of them are just open to just having dialogue with folks and building a relationship and a mentorship. So that's one way. Then they often will come in to do presentations or guest lectures or present at Social Impact Tuesdays. So that's a great time to interact with them. We at least have a couple of times a year, 2 to 3, where all the impact fellows come to campus, and we have made sure during that to have an opportunity for students to come mix and mingle with them and meet them. And that's often then led to relationships that continue outside of that. So there's a range of ways to connect with them. And I'm always happy to be sort of the point person to kind of make those connections happen. That's sort of how that works. And then in terms of do PhD students get involved differently than masters, I would say in general, everyone's welcome. Everybody can get involved in all sorts of different ways. I do think the PhD students have been really interested in, what are the community organizations I could do research with, and what connections do we have already with those community-based organizations? So I've been able to help provide some linkages in that regard. And a lot of the PhD students have formed some deeper relationships with some of the impact fellows as well. So those are some of the ways. I don't know if Kelly or Claudia, if you have any other thoughts on that question.
I was going to jump in on this other question of involvement for joint students. It looks, I
Mm.
would say, the easy answer is it looks no different, except that the timing might be a little bit different. I know. In other words, you can participate in all these things, but like your practicum might be at a slightly different time, or you just might have to be thoughtful about that. So that's a great question to bring to us if you have a particular timing need. But in addition, we're trying to build a broader team outside of the School of Public Health and find our peers across the university that are equally focused on social entrepreneurship and look to collaborate with them. Like this event around Medicaid innovation we did in partnership with the Haas Student Association focused on business students interested in health. So we're also looking to reach into some of those other communities and build things out. But I will also note that a lot of these opportunities are available to students even outside of the School of Public Health. There, for instance, the Social Impact Grant Program is open to all Berkeley students. But you're in the know since you're on the inside and can meet all the people. But you can always form a team, for instance, that includes a business person, a social welfare person, or an engineering student. And that's a really fun way to kind of build your broader peer group across the university.
And I would just add, I love the joint MPP, especially just a special place in my heart. And because we want our students also to be more involved in policymaking and advocacy. So I think there's a lot of possibility for how the policy students and the public health students can come together to make some of that happen. So we would love to talk to you more about possible ideas in that space as well.
One quick anecdote on the MPP, just because I love this so much. We had a joint MPH MPP student in Social Impact Tuesdays, and we announced one of our speakers, Marina Nietzsche, and he was like, "Oh, she's actually the author of the textbook for one of my Goldman School of Public Policy courses." So we invited his public policy course as well to attend. Her speaking, which was really cool. So we love to see those connections. Same with the Master of Social Welfare program, the MBA MPHs. I mentioned the optometry students. I'd love to have some folks from dentistry school. I know Berkeley doesn't have one, but there's some joint programs with UCSF. Each year we've also had students from the joint medical program, UCSF Berkeley, as well. So we love to see that cross Berkeley coordination.
Any other questions, you
I'll
all?
just mention that I think all three of us are going to be in person at Spring Visit Day. We're not going to have another in-person session, but feel free to come find us. And if you want to continue the conversation, more questions for those of you who are able to join us on Monday. Awesome. We'll be tabling. So come find us
Yeah.
there.
Yeah, in the late afternoon, there's a resource fair, if you will, and we'll be there. And we have some brochures and other things. And definitely check out our website. I think it's been posted here. If you just want a little bit of a deeper dive on some of these programs that you can take advantage of.
I'm sorry to say I don't know when diversity days are. So maybe we'll do our own research on that on our end. But that's good to know.
Yeah, indeed. I also don't know, but we'll look into it.
Hi, could I ask another question catered more towards the students?
Of course.
Okay, thank you. So, my understanding is I know like in the program you have to do like you're doing a lot of stuff. So I wanted to ask the students how it's been juggling like their coursework and any other like jobs or anything like that along with the fellowship.
I actually released the students because they are so busy. So I will
I'm
speak to
still
this a
on.
little bit.
But Rue is here.
It's
Rue
Oh, Rue, you're here.
Rue is
Yay. Okay,
here, and
Rue,
Devin
go
and
ahead.
Devin is here. So we've
Oh
got a
yeah.
couple.
So we're great.
Yeah, that's a great question. Just a quick background. So I'm a wife and a mom of three girls. So just in terms of like balancing it all, that was one of my major concerns of coming to Berkeley. And I've been able to do it. So actually, when we did the inaugural social impact innovation, I had just given birth. My baby was 3 months old. So again, it's about support. I think when you have such a wonderful support system, even though there's many responsibilities and you all have lives outside of your academics, you're able to manage it all. So definitely, I've been able to do it. And again, it's about, just making sure you seek out the help that you need, and even just asking for resources, which they have a lot of. So again, I think it's just one of those things that you're able to do it. And on top of that, for many other folks, like working also. So, but they're able to balance it all. So I hope that answers your question. But yes, you all can do it. I'm living proof.
Yeah, Devin, do you want to hop on and share your thoughts as well?
Yeah, definitely I can say something. Yeah, let me pin myself too. All right, awesome. Yeah, so I would say balancing being a student, having work, I work at the social impact team and personal life, I honestly just comes down to intentional time management and really setting those boundaries and also just prioritizing your well-being. I feel like for me, like I really need to get like 7 or 8 hours of sleep. I try to work out every day and eat good. I feel like just maintaining like my own personal life really helps balancing everything. And I rely on Google Calendar or like BeCal for everything. So I note down when I'm studying, when I have work, when my classes are. Literally, like when I'm hanging out with friends, I'm like, send a BeCal over because I need to put into my calendar because you have to coordinate everything. So just making sure that you're really intentional with your boundaries and ensuring that you have time for both school and your own personal activities. Because you really want to monitor like yourself because burnout can happen really quickly. So being proactive about it and ultimately, I just remind myself why I'm pursuing this path and really staying grounded in my passion for public health and policy can keep me really motivated.
All right. Well, I think we are at our time. But obviously we're happy to stick around if anyone does want to ask any more individualized questions. But otherwise, just really thank you all for attending, and we really hope you'll strongly consider Berkeley as your choice. And we'd love to work with you. So that's the wrap, I think, on our end. So thank you all so much.